Good day, everyone. I'm Glynes Garcia, and today our topic will be the difference between standard precaution and transmission-based precaution. Now, let's discuss the difference between standard and transmission precautions. Standard precaution. Precaution used to prevent transmission of disease that can be acquired by contact with blood, body fluids, non-intact skin, and mucous membrane. These measures are used when providing care to all individuals whether or not they appear infected or symptomatic. Standard precautions are basically used to protect the healthcare provider from potential infection. For example, if the nurse is irrigating a wound, a standard precaution for that wound would be to wear goggles in order to prevent infections through splashes into the eyes. Standard precaution consists of the following particles, which includes first, the hand hygiene. Hand hygiene is a way of cleaning one's hands that substantially reduces potential pathogens such as harmful microorganisms on the hands. Hand hygiene is considered a primary measure for reducing the risk of transmitting infections among patients and healthcare personnel. Respiratory hygiene. Respiratory hygiene and cough etiquette are terms used to describe infection prevention measures to decrease the transmission of respiratory illness. Always carry some tissues with you whenever you head out, sneeze or cough in the tissue and dispose it off at a safe place. Next. The sharps safety. Sharps or needle stick injuries are generic terms for injuries where infectious blood or other body fluids can come into contact with wounds or mucous membranes. The most common injuries are needle stick, puncture, or cuts with medical instrument. Individuals working with sharps should take necessary precautions to prevent injury and exposure to biological, chemical, and other potentially hazardous agents. Use of personal protective equipment is equipment worn to minimize exposure to hazard that cause serious workplace injuries and illness. It is commonly referred to as PPE. PPE is equipment that will protect the user against health or safety risks at work. Safe injection practice. Injection practice include measures taken to perform injection in a manner that is safe for patients and providers. Safe injection practices are aimed at maintaining basic levels of patient safety and provider protections. Sterile instrument and devices. Instruments are placed in a surgical pack and exposed to steam under pressure. Steam or autoclave sterilization is the most common method of instrument sterilization. The last one is the clean and disinfectant. Cleaning and disinfection is a process that reduces the number of microorganisms to a level at which they do not present at risk to patient or clients. Cleaning with a household cleaner that contains soap or detergent reduces the amount of germs on surface and decreases the risk of infection from surface. Transmission-based precaution. Additional precaution applied for patients who are suspected or known to be infected or colonized with infectious agents. It is also combined with standard precaution as needed. It means to say that transmission-based precautions are precautions that we know, that we use because we already know the diagnosis of the patient, or we know what infection the patient has. Transmission-based precaution is usually used in combination with the standard precaution. For instance, if the patient has a diagnosis of tuberculosis, the transmission-based precaution for that will be wearing the N95 or the particulate respirators mask because it is an airborne infection. There are three types of transmission-based precautions: the contact precautions, the droplet precautions, and the airborne precautions. First, the contact precautions. Contact precaution refer to infection prevention and control intervention to be used in addition to routine practices. It is spread by direct or indirect contact with the patient or the patient's environment. Droplet precautions. These droplets are relatively large particles that cannot travel through the air very far. They are transmitted through coughing, sneezing, and talking, used to prevent the spread of pathogens that are passed through respiratory secretions. And last is airborne precaution. Are bacteria or viruses that are most commonly transmitted through small respiratory droplets. Airborne precautions are required to protect against airborne transmission of infectious agents. And that will be all today. Again, this is Glynes Garcia. Thank you.